All right, everybody, welcome back to the channel. Today we're going to talk to you guys a bit more about the upper body. More specifically, we're going to tie together your shoulder stiffness, neck stiffness, how those guys are related, and how both of them can contribute to those headaches, referred to sometimes as stress headaches, anything you're getting up around that ear, even into the forehead, how all of those things are connected. So to get there, we're going to talk a little bit more about upper fiber traps. More specifically, you guys will know it as the trapezius or the traps, that gigantic triangle that connects your back, your spine, into the shoulder, and up into the neck and the base of the skull. So tension in that upper third, the part that's right on the top here that you can really kind of dig your hand in and feel, can result in a couple things. It attaches to the outside of the shoulder, so tension there can actually pull that shoulder blade up into an upward rotation, which closes down some space in that shoulder joint. And this is an important topic because that shoulder actually doesn't have a lot of space in there. Very mobile joint, but a lot of stuff going on. Just the shoulder blade alone has about 18 muscles that connect to it. Not to mention the vasculature, so your arteries and veins that are running through that area, and the nerves that are also part of the process that goes on in that shoulder. So we need a lot of space, as much space as we can in there. If we're getting that tension that's pulling that shoulder blade up, we're closing down on that space. To make up for that, we might get a little side bend in the neck as well. Again, you're talking about tension. Anytime we're talking about tension, you gotta think about that muscle shortening up. As that muscle shortens, pulling that side bend, lifting that shoulder, you're putting yourself in a poor position. The tension then refers that pain up in those headaches, that question mark pattern that we were talking about before. So how do we help? We're gonna give you guys 2 stretches to do. That's gonna help, one, with the tension through that upper fiber trap. It's also gonna involve a lot of the other muscles, posterior aspect of the neck, even some guys up at the front here. Talk about your SCM, that good thick guy in your neck, and your suboccipitals, the guys in the posterior aspect of your head and neck. All right, so 2 simple stretches for you. One nice and static, the other one will add a little bit of rotation. We'll get working on your coordination and see how you can feel the difference between one stretch and the next. So nice and easy, simple one. First to go here is just a lateral bend opposite of the pain. So we're going ear to shoulder, opposite of our tight trap. So what we want to do, if we can think about a tight trap, bringing those origin and insertion points together, we want to lengthen that space to cause that stretch. So what we'll do is lean away, ear to shoulder on the opposite side, creating space on the side of pain. If we want to intensify the stretch just a little bit, we can be sitting, holding onto the bottom of the chair that we're sitting on. That'll anchor our shoulder down, and then we can get a little more length from one side to the next there. Now, talking about a little more movement with our second stretch. The true tension in our upper fiber trap will bring this action as well as a look away as it attaches the SPs and yanks on them for rotation in the opposite direction. So what we're gonna do now with a little movement in this next stretch is go smelling our armpit in the shoulder away from us, and we can rotate, look up and look down and up and down to really work on moving that stretch a little more posteriorly as we look into the armpit, and then bring it back a little more to that outside as we look up and away. So 2 simple stretches for you guys, things you can mess around with. Again, let tension be your guide as you hold these stretches. If you hold them for 30 seconds, chances are you're not gonna get a ton of relief in there. So really push the limits on it, find that nice tense area, and really work on your breathing and hold that stretch until that tension melts away. Keep up with the work, guys. Again, if you enjoyed the video, give us a like, subscribe to the channel so you guys can see the new content coming out next. And as always, whatever you do, do it well.